And joining me to diagnose Asia's Zika concerns is Kathryn Jacobsen, professor of epidemiology at the Department of Global and Community Health at George Mason University. We've talked about Zika before, but what would you say is the biggest concern when it comes to Zika in Asia?
So we're still not sure what's going on. Zika's been in Asia since the 1960s. And genetically, it looks like the current strain that's happening in Singapore is related to these strains that have been in South and Southeast Asia for a long time. So it's different than the strain that's happening in the Americas, but it's too early to tell now what that means. The best case scenario is that this is a strain that doesn't cause birth defects, but we're not going to know that for about 9 months. And so right now, there's just a lot of uncertainty about what is going on with Zika in Singapore. It's possible that we're seeing a lot of cases now, partly because people worldwide are looking for Zika. A year ago, Zika was considered to be a mild infection that didn't really cause symptoms, so we didn't test people for it. So it could have been in Singapore for a long time and we didn't know it. But certainly right now, given what we've learned over the past year about Zika, the concern level is very high.
Well, different strain, that is confusing and maybe worrisome to people who don't know a lot about Zika. I'm wondering if this is a type of virus that can mutate. How does it happen, and how do you know that it is different than what we're seeing in Latin America? Does it travel? What's behind the different strains?
Right, so just like with influenza, we sometimes say, well, this is a bad flu season. Last year, it wasn't such a bad flu season. They're all influenza virus, but it does change over time. We're still not sure what happened to Zika that changed it so that it behaved differently in Brazil. We've only been tracking this for about a year, and a lot of science has been done, but we still don't have the answers. And so we don't think that Zika is something that mutates rapidly, but now with these cases in Singapore, the scientists are really going to be shifting and looking at, do we have two very different behaving types of Zika strains, or is this really all just Zika? And again, we'll be following the Singapore cases really closely to see where this develops.
What do you think governments have learned, other governments around the world have learned by watching what had taken place in the Americas?
Right, I think one of the big things is that we are doing surveillance. And so governments all over the world now are testing for Zika, and that's how we're able to detect these cases. So cases have been diagnosed in Thailand this year, and also in Malaysia and Indonesia and Vietnam. Not large numbers of cases, and often those are in travelers, but now that we're looking for it, we're able to track it. We're able, hopefully, if there's a local outbreak like we've seen here in Florida in the United States, we can get ahead of it. We can go there and do the mosquito control to try to keep it from spreading beyond one neighborhood or a smaller area.
A lot of concern about Zika possibly in India and what could happen there if there's an outbreak. Is it just because the number of people, the population?
Right. India, of course, is one of the two most populous countries in the world. The mosquitoes that spread Zika love urban areas, and India has a lot of very urban areas, just huge cities all over the country, and it's in a climate zone where the mosquitoes thrive. And so mostly the concern is just that there are a lot of people who are at risk. By contrast, in China, it's really only along the coastal areas toward the south where the mosquitoes that spread Zika could be found. For India, it's pretty much the whole country environmentally could host these mosquitoes.
All right, Guangdong province there in China. Kathryn Jacobsen, as always, we appreciate your insight. Thanks for joining us.
You're welcome.